Hi, this is Morgan Butler making my initial post for the clinical judgment simulation. So the video that we watched was representing discharge instructions and procedures. It looked like on a labor and delivery unit. The nurse was discharging mom and baby. So let's see. For question number 1, it seemed like the nurse was trying to provide education and maybe was a little bit rushed with everything. It didn't seem like she was listening to the patient or addressing things that I would consider as issues. So the nurse, came in, talked to the patient about her discharge stuff. She tried to make sure that the patient was comfortable with diaper changes. The patient didn't really clarify whether she was or wasn't. The nurse did go through the procedure for that, but it did seem, again, kind of rushed. She didn't validate any teaching with the patient. So some of those things is related to question number 2. Some of those behaviors, I wouldn't really consider them as caring, kind of rushing through things, not validating that the patient understands. That's kind of difficult. It's important to validate learning when you're teaching patients. And very early in the video, the patient mentioned that she didn't have a home, and the nurse didn't even address that at all with the patient. Even out in the nursing station, I guess, when she was speaking to the other nurse, she only said, the patient isn't concerned about the diaper changes, she just wants to know, is the baby cute? And she wants pain medicine. But really, the biggest issue is we're about to send this young lady home with her infant, and she doesn't have a home. She doesn't have somewhere to live. So I feel like that should have been addressed rather than moving on to diaper changes and prescriptions. I've said it before, case managers are fantastic. It's really important to get them involved in cases like that. And I wouldn't have proceeded with discharge teaching in that situation. Question number 3. If I had been presented with that scenario, the patient said, I don't have anywhere to go, I don't have a home, I would have focused on that and addressed that problem, and then you can continue with discharge teaching. Number 4, priorities for the patient. The patient was concerned about pain medication. She mentioned she didn't have a home. So I think those were the patient's priorities. She wasn't focused on caring for the baby, maybe because of those other issues. And in this particular scenario, from the nurse's viewpoint, it seemed like she was more focused on getting the patient discharged because the unit is busy. She had more patients. She seemed to kind of want to get through it and not really address everything that needed to be addressed. Question number 5. Resources for this patient. Like I said earlier, case management, getting somebody involved to help the patient with outside resources where she can go because she doesn't have a home. The patient voiced concerns about the prescriptions that she was going home with. It's okay to ask the doctor, hey, I know we're going to give her Motrin to go home with. She said it doesn't work for her, she doesn't like it. Can we consider something else? It doesn't necessarily have to be another narcotic, but maybe an alternative pain medicine. Again, I think case management and explaining resources that the patient can use out in the community are vital to her and her baby. Question number 6, transferring what I learned from here to the practice setting. I always try and listen to my patients and address what their issues are, really focusing on what they're concerned about, and then get into teaching and really try to validate learning. I think that's really important so those things can be applied to the practice setting.